Now we're going to talk about tilt and recline frames. They are available on both a manual and power frame. So the tilt refers to the ability to rotate a specific seating position around a fixed axis, thus changing orientation in space. So it just moves the entire seat in a different position. So recline refers to changing the seat to back angle, resulting in a seat to back angle greater than 90. So basically just kind of reclining in your seat. They both have common benefits. So they both provide a change of position, improved circulation, so bringing pressure relief and greater comfort. It also has the potential to improve head and postural control, providing an improved functional position and influence on muscle tone. So moderate tilt and recline positions often reduce the effects of gravity, allowing a more upright position, aiding in function. They have the potential to improve respiratory function, provide a better visual field, regulate blood pressure, ease transfers, and allow rest during the day. So it can also, it's also used to achieve a more typical spine alignment. So it can reduce a thoracic kyphosis. So the recline one on the slide on the right side is useful for individuals who become fatigued when they are sitting upright for a lengthy period of time. So it allows them to rest without transferring to a bed. Also, clients with a hip deformity that limits their ability to flex the hip will benefit from the recline to achieve a more comfortable seating position. It can also alleviate orthostatic hypotension. It can improve bowel and bladder function. So the recline does not raise the knees during the position change, which allows this position to be used when still continuing to work at a desk or a table. But recline is not always a good option. So if somebody has cerebral palsy or has sustained, I can't say that word, a head injury, it can cause excessive extensor tone because of the hip, opening up the hip angle. So it might not always be useful if they have a limited hip extension range of motion. Also, you have to keep in mind of shearing, which is a concern when changing a seat to back angle. So in chapter 9, Sam and Felicia went over the shearing is the friction that occurs when two surfaces slide across each other. So that's something to always keep in mind with these type of frames, because depending on the center of gravity, their shear can happen. So you always have to make sure that they are positioned right before any of that happens. So the tilt systems are recommended when it's desirable to maintain the seating position for function or for control of other devices mounted on this wheelchair, such as augmentative or alternative communication devices. So you also have a rearward tilt. Then you have a lateral tilt, and some have, which is a tilt in the sagittal plane. So tilt systems also pose some disadvantages that recline systems do not. So most systems increase the seat to floor height. So when the user is in the tilt position, their knees are raised, sometimes higher than the level of the head. So that might interfere with the ability to work at a desk or a table or pose a risk for injury if the user attempts to move into the tilted position while at a desk or table. So ideally, if someone needs to rest from fatigue, but they're still working at a desk or something, they would use the recline versus the tilt, which is actually moving the entire seated position. But like with the recline, if people have hip injuries or things like that can't do the seat to back, the tilt is a better option for them because it maintains the hip angle. But bladder constriction might occur because it can cause problems with fully emptying the bladder because they're in the seated position. Also, extreme degrees of the tilt may cause the user to feel posturally insecure, which has the potential to increase muscle contraction because they are tensing up because they feel probably like they're going to fall. Also, it's going to interfere with the use of a tray because the tray is just going to slide off into their lap. So you are going to have to look at the user and look at what they need. If they are more fatigued just sitting up, or if they actually need to fully lay down, that's when you are going to make your clinical judgment on which frame that they might need.